We're going to learn more about surgical weight loss. And joining us today, a bariatric surgeon with Mercy Health St. Rita's, Dr. Jason Bowersock. And thanks for joining us.
Good morning. Thanks for having me.
Okay, so we hear a lot now about weight loss drugs. So what's the difference between the drugs and a surgical possibility for weight loss?
So the drugs is going to be part of the weight loss management with medical management. You know, before you get the surgery, you really do have to try to exhaust all other options in regards to the medical management aspects, specifically nutrition. We always talk about very heavily. That's the backbone, of the program. Exercise is definitely going to be involved in that. And then along with nutrition, exercise is going to be the weight loss medications. And there's a plethora of medications out there anymore. There's some of the older medications like the stimulants. Those are going to be some of the cheaper, easier ones. The GLP-1s is the hype. That's what you see in the media a lot. They have their goods and their bads as well. But you kind of have to go through all of that before you kind of get to the surgical option. And when you do get to the surgical option, it's not like you don't involve any of that other stuff beforehand, because we still implement nutrition, exercise, and the weight loss medications before and even sometimes then thereafter surgery to try to get them the most weight off of someone for the longest time possible.
So what are the type of procedures then that you can have for medical surgery?
For surgery weight loss, the two main ones out there right now are going to be the sleeve gastrectomy and then the gastric bypass, or the Roux-en-Y gastric bypass. The sleeve gastrectomy would be the most common anymore, simply because that's where you're going to just lose about 75 to 80% of your stomach, but you're not rearranging the rest of your GI system. So everything below the stomach still stays normal. With that, you still lose a fair amount of weight, but you don't get into some of the other malabsorption, potential deficiency options of the bigger procedures. The gastric bypass, now that's the longest term one. That's the one that we've been doing for decades. We know the goods and the bads about it. But that's where you get a small pouch of a stomach, but then food kind of goes the other direction. All your enzymes that break up your food still goes the normal direction, and then they all meet kind of halfway down. So it's restrictive like a sleeve. Small stomach can't eat as much, but it's also more malabsorptive to where instead of having, say 6 feet of bowel that you can absorb your nutrition, you only have, say, 4 feet, so you just don't have as much length. So you lose a little bit more weight with it. But with the bypass, you got to be a little better, especially with your nutrition, to ensure that you're healthy long term.
I was going to say, just because you have the surgery, you still have to watch what you eat and, be conscious of all that, right?
Yeah, 100%. I tell everybody, we'll get you to a new weight loss with surgery. Somewhere between 25 and 45% of your body weight can go away, but that's not long term. So it's just like medical management. We can get you down some weight, with nutrition and exercise, but that doesn't mean it's just going to last forever just because you got down there. Same way with surgery. It's the most likely way to lose a fair amount of weight long term, but still that's only about 65%. Which is way better than medications, which is around 15 or 20%, which is still way better than just nutrition exercise, which is less than 3 to 5%. But still, it's only 65%. And the ones that fail are the ones that, they go through the process, they get the surgery, they do well for their year, but then they kind of get back into their same, I say the good American diet. They get back into the sugary drinks, the meals, the trying to eat too much, too often, sedentary lifestyle. You're going to gain some of your weight back. Now, it's harder to do because you can't eat as much, but you can still do that with surgery.
Okay, so if someone's thinking about some of these lifestyle changes and want help, is it first make a phone call and get involved with your office and the program?
Yeah, so you make a phone call, and then we really start the patient to where you can honestly get a lot of information without having to go anywhere, because the first thing is to where you'll just get online and listen to a 45 to 60-minute video, and that tells you about everything about the program in regards to the dietitians that we involve, the medications that we can involve. We have an exercise physiology department here to where we have our own fitness center that you can be involved in, all kind of support groups. And then once you kind of go through that video, then yeah, you make an appointment with us, and then we kind of start you off on depending on what you feel you want to do and how aggressive you want to get with your weight loss.
All right, it's quite the journey and quite a few options nowadays. Thank you very much, Dr. Bowersock, for joining us.
Not a problem. Thank you.
All right, don't go away. Noon Edition continues in a moment.